Hi, I'm Linda Bell. I'm a clinical practice specialist at AACN National Office. And right now I'm with one of our colleagues who's experiencing the surge in Southern Florida, who has agreed to spend some time with us today.
Thanks, Linda. My name is Kevin Cho Tipton. I'm a critical care nurse practitioner here in South Florida. I've been practicing in nursing and medicine for about 10 years. Started off as a CNA, LPN, then RN. For the last 5.5 years, I've been working in critical care units, mostly across South Florida. I work in ICUs at the two public hospital systems here. They happen to be the first and the third largest in the country. That's Jackson Memorial in Miami and Memorial Regional in Broward County. I'm also a captain in the Florida Army National Guard. I've been there for about 10 years, and I teach as an adjunct at the local community college.
So I notice on your Facebook posts almost daily, you're including the data about Southern Florida and Florida. How did you get involved in managing or looking at the data as part of your daily routine?
Well, to be perfectly honest with you, I don't have a lot to do at home these days. My family is dispersed. I don't have kids to take care of, so it's giving me time to focus on researching how to treat this disease process better and keep up to date on the knowledge. At that same time, I found myself getting more in depth into the epidemiology and what was happening locally. A lot of national reporting goes on, but I wanted to drill down what's happening in Miami, understand why it's getting so bad here right now. I don't necessarily have an answer for why it's so bad right here right now, but I did start to find a lot of discrepancies in the data reporting from the county, from the city, and from the state. And then I just started looking at raw numbers and realized that, a lot of nurses and doctors and healthcare professionals across the country talk about their personal experiences in the hospital, but without the data, it's difficult sometimes to marry what's happening in the hospital with the gravity of what's happening nationwide. So I wanted to impress upon people, look, these numbers represent people, but these people are also part of a greater whole, that we're seeing thousands, record numbers of people hospitalized, diagnosed, and now we're seeing increasing amounts of deaths. And I wanted to paint both a data-driven picture and the very nurse-driven, people-driven picture, and that's what was important to me.
So given what you know, what you've been through, what advice would you give to other APRNs who are either expecting a surge, in the middle of a surge? What would you like them to know?
I will say to any advanced practice person that remember that you're going to be more than just a medical leader. You're going to be a team leader. Spending the last 10 years as a reservist in the military, I've realized that, let me put it this way, for a nurse's aide, the circle of what we could do was very small. Take vital signs, talk to the nurse. As an LPN, it got bigger. As an RN, it got bigger. But as an APRN, it's even bigger. But it still includes all of those things that go down to the very, very smallest level. I'm not saying that nurse practitioners and PAs and providers need to start getting at the bedside and doing these things. But remembering your roots, remembering that the stress and the strain on the bedside staff is incredible, and that we have the privilege as advanced practice nurses to go create an environment that is both conducive to learning, because everyone's stressed, and also conducive to understanding that these nurses and bedside care providers, like respiratory therapists and pharmacists that are sometimes forgotten by hospital systems in recognition of what they do, are just as stressed as we are. So taking that understanding, taking that bedside knowledge, and also translating it to compassion, I think is important, not only for our patients, but for our coworkers.
So Kevin, you've been an active voice in social and public healthcare issues, and you recently put out a call for the authorities in Florida to mandate mask usage. Any progress on that front?
We have not had any progress on the statewide front. I think it's probably a mistake for us not to get more involved at the state level, because there are 67 counties in Florida. Haphazardly instituting mask laws allows people to, I think, with a reasonable excuse, to say, oh, I'm from Naples, or I'm from Collier County, I'm driving over to Fort Lauderdale, I don't need to wear a mask in public. And with 20 million people here, it's very difficult to get everyone on the same page unless you have state mandated orders, I think, from Tallahassee, and that's what we need when we have record-breaking hospitalizations, diagnoses, and now increasing deaths across the state.
Kevin, elsewhere across the country, we hear stories about disparities and healthcare for disparities during this pandemic. What is it you're seeing in your area?
Well, like New York City, we have a huge immigrant population. To take, for example, Miami-Dade County. More than 70% of Miami-Dade speaks a language other than English at home. In addition to that, we have a large native population. The Seminole Indian tribe is here. Almost all of internal South Florida between Miami and the other coast is a native reservation. We are seeing huge disparities not only among that population, but really distributed amongst those that are poor. There is, of course, a racial component to this because of the disparity between poverty within communities. Since 25% of African American and Latino families are in poverty, we are seeing increasing numbers of these people in hospitals. The problem is, at the same time, there was supposition about the socio-cultural aspects of Italy, how people kiss each other in the face to greet each other. There is some suspicion that may be why the virus is getting is infecting more people locally in Miami because of the heavy influence of South American and Caribbean communities. In addition, we are seeing how poverty during shutdowns is really destroying communities who have a lot of people who are in poverty. Not only are these people more likely to live in multi-generational houses, so grandparents taking care of grandkids, but they're also the most likely to lose their job during the shutdown, and also during shutdowns in general, and also the most likely to be working in areas like service industry or as barbers and at restaurants where they're going to get exposed to the virus with little to no preparation. And so I think it's doubly unfair that they're being affected most by the shutdowns because as nurses and doctors and healthcare workers, we have too much work. We are still getting paychecks, but these people that are being affected are truly the victims of this, both from the virus itself and from the economic effects. And today, unfortunately, about 15% of Miami is out of work, and 25% of Miami is at or below poverty line. And so they're facing the combined effects of the disease. Plus, if they lost their job, 50% of Floridians get their health care from work. So now they're out of work, out of access to their doctors, and with unemployment and Medicaid taking so long to get signed up onto, they're in a unique position where they're facing a pandemic, don't have access to their medical care, and they're jobless. And it's just a very cruel cycle that not just here in Miami, but across the country, but certainly in these communities of color and especially Native communities right here in Miami.
I want to thank you for giving us your time. Is there anything else you'd like us to know before we sign off?
I would just say that, look, I think that this is going to be a marathon nationwide. And I focus so much of my attention on Miami because the national media it's truly national. And so thank you for letting me talk about what's happening here. And look, there are 200 nurses and doctors and respiratory therapists and pharmacists coming from all over the country to our public hospitals here in Miami. And so for them, if anyone sees us, thank you so much for coming. We all really appreciate it.